Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is finding balance between activity and energy conservation during active treatment. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Exercise is a vital component during both chemo and radiation, but how much, how often, and what kind depends on the type of treatment, side effects, and day to day energy levels. Why exercise during treatment? Research shows that it maintains or improves physical function, helps manage cancer related fatigue, reduces anxiety and depression symptoms, and it also improves health related quality of life. Here at Maple Tree, we have a strategy called the Bad Day Adjustment. This is designed to support patients experiencing side effect fluctuations during chemotherapy or radiation treatment cycles. I want to let you know that there are going to be ups and downs. We know that side effects such as fatigue and nausea will vary within a treatment cycle, whether that be day to day or week to week. Reducing the exercise intensity on days with low energy or heightened side effects, taking breaks, using just body weight, being flexible. It's essential to listen to your body by remaining aware and flexible to your current physical and emotional state. Your safety, your confidence, and your comfort are a higher priority than progressing in an exercise movement. It's also important that you modify as needed. So whether that be it's a shorter exercise session, maybe you focus on breathing or stretching, or instead you switch to seated movements. Again, your safety, your comfort, and your confidence comes first. Non-exercise activity thermogenesis is the accumulation of activity you do during the day that is not considered structured exercise. And this is important because sometimes we don't have the energy to exercise. Even the smallest of movements can support. That can support and preserve function. Staying gently active throughout the day can help support circulation and reduce stiffness. Low effort movements can reduce feelings of fatigue, especially when done correctly. And this also helps you maintain a sense of normalcy, independence, and purpose to keep your daily routine. Some examples of non-exercise activity thermogenesis is grocery shopping, playing with your pets or your child, walking to and from your appointments, meal prepping, getting up to go to the bathroom, and even standing to brush your teeth. Simple movements that don't take a lot of effort. In these next couple slides, I'll be going over some tips for conserving your energy. The first one is prioritize what matters most. That be your treatment, nutrition and hydration, movement and rest. Focus your energy on the most important tasks and let go of what can wait. The next tip is to plan ahead. Schedule your energy heavy tasks during your good energy times. Maybe that's in the morning or right after you eat. Try not to overload your day. Spread your tasks across the week. Maybe you don't put 2 appointments in one day to give yourself some rest. And then build in rest breaks. Schedule them out like it's a doctor's appointment. The next tip is to sit when you can. Keep a sturdy chair or a portable stool in areas that you use often. Sitting reduces energy use and helps prevent fatigue, dizziness, and shortness of breath. You can sit while you brush your teeth, preparing meals, showering, and even folding clothes. Accept help. Allowing friends or family members to assist with groceries, cleaning, meal prep, etc., is super important. People often want to help, but they don't know what to help with. So be specific when you are giving someone something to help you with. And then accepting help isn't a sign of weakness, it's a way to protect your energy for healing and recovery. And the last set of tips I have for you is to pace yourself. You want to break big tasks into smaller steps and take them one at a time. Alternate between activity and rest. For example, folding laundry, then sitting down and resting before putting the laundry away. Use a timer or a reminder to take regular breaks, even if you're feeling okay in the moment. And lastly, don't wait until you're completely drained to rest. Thank you for being a part of our conversation today on finding the balance between activity and energy conservation during treatment. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, my name is Jared, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 2. Today we're going to get through 2 different circuits. One of them will be at a wall, so please find an area where you have enough room. You can also use a sturdy doorway, and we'll also need a sturdy chair. The following exercises are meant to be pain-free. If you notice any pain in any exercises, please skip and go back to what felt good. There may be some discomfort, especially after surgery, but there shouldn't be any pain. Now let's get started. All right, now we're going to start stretching before we get into our workout. Our first stretch is going to be the mountain pose. We just did that last week. So you're going to take your arms, put them together, intertwine your fingers, and stretch. Let's come back down, and we'll do the same one more time. Bring your arms up, intertwine your fingers, and stretch up. Now I want you to stay up here. Bring one arm down and side stretch. Bring that arm back down and side stretch. Excellent, excellent. The next stretch we're going to do is called elbow winging. So like we had our fingers intertwined up at top for the mountain pose, we're going to do that same thing behind your head, kind of like make wings with these elbows of yours, okay? And then bring them towards your head. Just like that, hold, and come back out. Let's do that 2 more times. Bring that in, hold, out, and last time, hold, and out. Excellent. You can bring your arms down now. I want you to take a wider stance, just a little bit outside of your shoulders, and we're going to do some lunges towards the side. So you stretch over here, and then back to the side. These are some lateral lunges, not too far down, just getting our adductors in here nice and open and nice and warmed up. Let's do it one more time. And last one. Great. Let's stand up, and we're going to do our heel cord stretches, which we also did last week. So you'll have one leg forward a little bit with a bent knee, straight leg, and lean forward. Get that nice stretch in there. 5, 4, 3, 2, 1. Now let's do the same with the other leg. Little bit of a bend, straight leg, bend forward, and let's count down from 5. 5, 4, 3, 2, 1. Excellent. If you need your chair, go ahead and grab your chair at this time for our hamstring curls. I'm going to go ahead and try it without. Like we did last week with your hamstring curls, you're going to keep your knees right across from each other and just bend at your knee. Okay, there's a little bit of leaning involved. Once you have a nice strong core, okay? Stand up nice and straight as well. Let's do 2 more of these. 1, 2, and 2. And that's all we have for our warm-up. All right, we're nice and warmed up and all stretched. For this part of the workout, you're going to need your wall. The first exercise we're going to do is something called a knee drive. You'll have both hands against the wall, and you'll be bringing up your knee. So come over to your wall, both hands up. I want you to push your legs out so that there's some resistance, and bring up your knees. We're going to do 10 on each side. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, keep going, 7, 7, 8, 8, 9, 9, last one, 10, and 10. We're going to be coming back to that, so don't get too relaxed. Next is our wall plank with shoulder taps. It's going to be the same position, but our hands are going to be rotating and touching our shoulders. So go back into that position you were in for the knee drives. You're planking against the wall, but this time your hands are tapping. 2, 2, 3, 3. We're going for 10. 4, 5, 5, 6, 6, 7, 7. Almost there. 8, 8, 9, 9, 10, and 10. Perfect. Great job. And last is our lateral adductor wall plank. Once you take your forearm and lean up against the wall, you're going to bring one leg up and back down. We're going to do that 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And turn around and do the other side. Lean in and let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. That's the first part of the circuit. We're going to repeat everything, starting with knee drives, then go into the wall plank, shoulder touches, and finish with the lateral adductor wall plank. So let's get started on the knee drives. Don't forget, we're doing 10 on each leg. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, halfway there. And 7, 7, 8, 8, 9, 9, 10, 10. Do you remember what's next? It's the wall plank touching our shoulders. So stay in that position, lean back, and go. 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Last one, 10, and 10. Last one for the wall. I'm going to have you take your forearm, lean up against there like you're doing a side plank, and you're going to bring that knee up for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Turn around, put that forearm up against the wall and lean. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Woo! Hope that felt great for you. That completes the wall portion of our workout. We're ready for our chair portion of the workout. Make sure your chair does not have any wheels and is nice and sturdy. So go ahead and grab your chair, and we're going to do some toe taps to the chair. We're going to do 20 for each leg. 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, and we're halfway there. Let's go. 11, 11, 12, 12, 13, 13, 14, 14, 15, 15, 16, 16, almost. You're almost there. 18, 18, 19, 19, 20, 20. This is a workout, so we're trying to get you a little bit winded, okay? Next is high knees with a cross body punch. If you need the chair for support, you can hold on to it, but I would really like you to try and not use the chair for this portion. So we've done high knees before, but what we're going to add is a cross body punch. And we'll be on opposite sides. So when your left leg goes up, your right arm crosses. And the same with the other side, right and left. So let's try for 20 of those. 1, 1, 2, 2, 3, 3. There you go. 4, 4. You're getting the hang of it. Excellent. 6, 6, 7, 7, 8, 8, 9, 9, 10, 10. Keep going, keep going. You got this. 12, 12, 13, 13, 14, 14, 15, 16, 16, 17, 17, 18, 18, 19, 19, 20, and done. Should feel that. Do you feel that? Take a deep breath in through your nose and exhale through your mouth. Whew, I know I felt that. Go ahead and grab a drink of water as well, and I'll explain the next move while you're doing that. You're going to take your chair. All right. And you're going to go into a partial squat position. So about here, this is going to be home. And then you're going to go down, and as soon as your bottom touches the chair, you're going to come back up. 1. That will be 1. Okay? We're going to try, let's try 10 of these, okay? 1, 2, 3, 4. Doing good. 5. You should feel the burn. Do you feel the burn yet? 7, 8, 9, and 10. Excellent. Woo! Are your legs on fire? Are you feeling that yet? Well, guess what? I'm going to let you sit down for this one. How about that? So go ahead and have a seat. Relax just a little bit. We're going to keep working out. This is called a static knee hold. So you're going to bring your knee up for 3. 1, 2, 3, and that's going to be 1. Then we're going to alternate and do the other leg. So this, 2, 3, that counts as 1. So sit back, relax, feel a little bit comfortable, because now it's time to work. Let's get started. 1, 2, 3, bring it down. 1, 2, 3, bring it down. 2, 2, 3, bring it down. 2, 2, 3, good. 3, 2, 3, 3, 2, 3, 4, 2, 3, 4, 2, 3. Keep going. 5, 2, 3, 5, 2, 3. Excellent. 6, 2, 3, 6, 2, 3, 7, 2, 3. There you go. 7, 2, 3, 8, 2, 3, 8, 2, 3, 8, 2, 3. That was 9. 9, 2, 3. Last one. 10, 2, 3. Last one. 10, 2, 3. Woo! We're doing so much movement. We're working all these different body parts. We got to be counting, using our brain. Like, it's a whole thing. So I hope you're on the same page with me. I'm getting tired. I hope you are too. But we've got one more circuit to finish of everything that we just did with the chairs. So let's get our chair ready. We're going to do those toe taps again. Okay? You can do them as fast or as slow as you need to. Just make sure we get 20 for each leg. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9, 10, 10, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. Almost there. 6, 6, 7, 7. Wrap it up. 8, 8, 9, 9. Last one. Woo! I'm feeling good. You feeling good? I hope that was a yes. I hope that was a yes. All right, we're going to keep our chair right there. Back to the high knees with the cross body punch. Get that heart rate up and keep it up. All right, let's go. Cross. 1, 2, 2, 3, 3, 4, 4. Try and stretch in here. 6, 6, 7, 7, 8, 8, 9, 9, 10, 10. Halfway there. Halfway there. 12, 12, 13, 13, 14, 14, 15, 15, 16, 16, 17, 17, 18, 18, 19, 19, 20, and 20. Whew. All right, let's get that chair back out. right here in front of you. Oh, take a big deep breath in for me and release it. Very good. Give me one more. And release. We're going to do that partial seated squat, you know, the one that your legs were screaming about just a few minutes ago. We got to do that one more time, but only for 10. We're not doing 20. So start a little low and go down. Oh, there's one. Very good. 2, as soon as your bottom hits the seat. 3, you're ready to go back up again. 4, 5, halfway. 6, 7, 8, 2 more. 9, last one. Whew, good job. Have a seat. Have a seat. Kick back and relax, but not too much yet, okay? We're gonna do those knee holds where we come up for just a little bit. We're gonna do 10 of those. We're gonna come up for 3 seconds and come back down. 10 of those. Let's go. 1, 2, 3. 1, 2, 3. 2, 2, 3. 2, 2, 3. 3, 2, 3. 4, 2, 3. Oops. 4, 2, 3. There we go. 5, 2, 3. 6, 2, 3. 6, 2, 3. 7, 2, 3. 7, 2, 3. 8, 2, 3. 8, 2, 3. 9, 2, 3. 9, 2, 3. 10, 2, 3. 10, 2, 3. All that counting, it gets me confused, guys, but I hope you're on board with me. Okay, now it's time for our cool down. I know if you're feeling like I am, you're tired. All right, so let's cool down and we'll be all done with this workout. Let's do some trunk rotations. We did these last week where you start with one hand over the other and you slowly move it over, twisting at your waist only for that good stretch there in your obliques. And then to the other side, slowly stretch. That should feel nice. Excellent. Trunk rotation. Let's do that one more time, okay? So we'll go over to the left and stretch. And then both hands over on your knee and stretch. Wonderful. Cool down's the best part of the workout. Do some neck turns. So we'll go right, left, right, left. Turn as far as you can by a little bit of strain, but no pain. That nice stretch in there. And the other side. These are slow movements. You don't want to pull anything in your neck or overdo it. All right, while we're doing neck stretches, let's look up. In through your nose and look down. Look down without hunching for me. Okay. Did our neck stretches. Let's do some overhead reaches. So you're just going to reach up as high as you can. Reach, reach, reach. And twist a little for me. Keep reaching, twist the other way. Awesome, awesome. Come back down. Then we'll do the cat-cow position. Okay, that's a yoga pose. So you grab both hands and put them on the outside of your thighs. Almost press into your thighs. You're gonna hunch over a little bit. Hunch over, and then straighten up. Let's do that one more time, okay? So hunch over, and then straighten back up. All right, that is it for the cool down. You're all done. You're all done. Great job. Proud of you. That's all for week 2. So I'll see you back for week 3.